So atrial fibrillation is a pretty common heart disease that we see. It's an arrhythmia of the heart that affects people of all ages, but mostly gets worse with age. It's a disease process where basically the upper chambers of the heart, called the atria, they fibrillate, meaning that they electrically go a little haywire. They start beating very fast, and then what that does is it causes the rest of your heart to beat very fast and not function properly. So when that happens, people can have various different issues. For example, they could feel palpitations, like their heart's irregular or skipping beats or racing. They can also feel short of breath and tired and dizzy. Sometimes they can even go into things like heart failure or have other issues. The other thing with atrial fibrillation is your heart is going so fast in the upper chambers that it's not clearing blood properly. And when that happens, people can develop blood clots and be at risk of stroke. So generally for treatment of atrial fibrillation, there's a couple of things we're looking at. One is we're trying to prevent strokes, and oftentimes these patients will need to be on blood thinners to prevent strokes. In addition, we want to try to improve their symptoms. So we want to try to lower their heart rates. You want to get them back to a normal rhythm, which means getting them out of atrial fibrillation. Sometimes we use medications to fix the AFib. Sometimes there's procedures to try to fix the AFib. So if you experience these type of symptoms or have problems similar to this, let your doctors know.